The U.S. Department of Agriculture has issued conditional approval for a bird flu vaccine for use in chickens. The vaccine from manufacturer Zoetis is one of multiple targeting bird flu in poultry. According to the USDA, avian flu has been confirmed in 146 flocks in the past month, affecting more than 20 million birds. 34 million egg-laying hens have been culled since December. Not all those birds necessarily tested positive for avian flu, but were members of a flock where a case was confirmed. Among humans, there have been at least 68 confirmed cases of bird flu last year, according to the CDC. One person has died from the disease. Over the weekend, Ohio's health department reported the fourth case of a person being hospitalized for bird flu. CBS News medical contributor Dr. Céline Gounder joins us on set. She's also the editor-at-large for public health at KFF Health News. So we've been talking about bird flu for quite a bit. I mean, is now the time when people really need to start paying attention with the number of cases that we have? I mean, those are pretty extraordinary numbers.
I think to put this into context, it would be helpful for people to understand how a pandemic bird flu emerges. And we have a graphic, I think, that's going to come up on screen here to help illustrate this. So the bird flu can infect birds as well as mammals, which include pigs, cattle, and cats. People can get infected with the bird flu when they come into close contact with infected animals. So farm workers, for example, are at high risk for infection. At the same time, people can get infected with the regular human flu during winter flu season. And so a person could get infected with both the human flu and the bird flu at the same time, especially if, say, they're a farm worker or someone else who comes into close contact with infected animals. So now the flu virus is made up of 8 different pieces of genetic material. When you have different flu strains infect a person or another animal at the same time, those flu strains can swap parts. And that's how you make a new hybrid flu strain. These new hybrid flu strains can be especially dangerous because now you can get the human-to-human spread, and that can spark a pandemic.
What is a horror movie? I mean, that is terrifying.
It's Frankenstein, right? You know, that's how you get these super scary Frankenstein flus. And the problem is we don't know. It's sort of like the more times you have an animal infected, a person infected with the bird flu, at the same time as seasonal flu, we have no way of predicting exactly when that swapping might happen. But we're increasing the hits on goal the more we allow the virus to spread.
Well, and if it's really mild among some of these animal populations too, then people may not know, they may not be able to track it, and it continues to spread. So the CDC has reportedly had 2 studies on bird flu ready to be published. What's the latest with those?
They're still on hold. They still haven't been published. They've been ready to publish, any day for a week or 2 or more. And one of those studies in particular is concerning because it shows that there's probably been spread of bird flu going under the radar among dairy cattle. And it's also concerning that we've seen this kind of tampering with the CDC's weekly publication before, during the first Trump administration. The political interference at that time was to make the COVID pandemic seem rosier, the situation seem rosier than it was. And to see that behavior reemerging now is really worrisome. That's not transparency.
Right, and we can't really fully address the problem if we don't have a full grasp on how deep it is, et cetera. So on Face the Nation Sunday, Kevin Hassett, who's the director of the National Economic Council under President Trump, spoke about the administration's approach to the outbreak. Let's listen.
President Biden didn't really have a plan for avian flu. Well, Brooke Rollins and I have been working with all the best people in government, including academics around the country and around the world, to have a plan ready for the president next week on what we're going to do with avian flu.
What do we know about that plan?
So first of all, just a little bit of fact checking. So the Biden administration did have a plan. Now, you may not agree with that plan, but they did have a plan. Numerous scientific experts were convened at certain points last year on a weekly basis. I was among them, where they were updating us. They were giving us the opportunity to ask questions. So there was a plan. Now, some of what he's alluded to in that Face the Nation interview, and of course we need to hear more details, is this idea of enhanced biosecurity measures. So that's really things like hand washing, PPE, and so on. The problem is that this is an airborne virus. And so just like COVID, we know that those measures can help, but they can't completely stop the spread. In fact, during prior bird flu outbreaks around maybe some 10 years ago, we saw evidence of spread through the air between farms. So that's not something you're going to be able to contain just with biosecurity measures. And then he also had mentioned something about medications. China in the early 2000s dumped antiviral, so anti-flu medications into chicken feed, and that ended up creating drug resistance, where you basically lost certain categories of flu medications, and you certainly wouldn't want to do the same thing all over again with Tamiflu and Xofluza, the two that we really have at our disposal now. And then finally, you have the vaccines that were brought up in the introduction to the segment. Some countries already do vaccinate for bird flu, so that's not the only bird flu vaccine. There are others that are used for poultry. The challenge there is we prevent the importation of poultry products when it's from a country that vaccinates against bird flu in their poultry. And so are other countries going to do the same to us if we start to vaccinate? Who's going to pay the farmers to do this? And then even if you do reduce the mortality, the deadliness of the virus among birds by vaccinating them, they still are likely going to be infected. It'll just be a milder disease, just like when we get flu vaccine ourselves, right? And so that means the virus will still be spreading. People can still get infected. And so what does that mean long-term still for the virus evolving and having a bird flu pandemic? You haven't really addressed that issue.
We likely will have you on again to talk about this. Much more ground to cover. Dr. Céline Gounder, thank you.